Hi there. I'm here to talk to you about vitamin D and how it affects your heart. Did you know that 9 out of 100 teens aged 13 to 18 in Canada are deficient in vitamin D? What are the implications of this? Well, vitamin D deficiency can have a significant negative impact on your cardiovascular health. Let's start off with a bit of background about vitamin D. It comes in two forms: D2, produced in plants, and D3, synthesized in the skin by ultraviolet radiation or through the consumption of certain fish oils. Once in the body, D3 travels through the blood to the liver where it's converted to calcidiol. This is the form of vitamin D that is tested for when we look for deficiencies. Calcidiol then travels to the kidney where it's converted to calcitriol, which is the active form of vitamin D that acts on receptors all over the body. Traditionally, calcitriol acts on receptors in the kidney, the bone, and the intestines to regulate calcium metabolism, but receptors can also be found in the cardiovascular system. Looking at its cardiovascular effects, vitamin D regulates the renin, angiotensin, aldosterone, or RAA system. Renin, angiotensin II, and aldosterone are hormones that regulate constriction of blood vessels and therefore control blood pressure. Normally, calcitriol suppresses renin synthesis in cells by binding to a surface receptor and eventually influencing the DNA in the promoter region of the gene. So, without calcitriol, more renin is produced. An increase in renin will increase the production of angiotensin II, which is a potent vasoconstrictor. Vasoconstriction leads to high blood pressure, also known as hypertension, which increases the load that the heart has to push against to eject the blood, the afterload. Increased afterload leads to adaptive changes in the heart that cause enlargement of the smooth muscle in the left ventricle, or left ventricular hypertrophy, which can cause a variety of problems as it progresses. Secondly, vitamin D deficiency is linked to atherosclerosis. Atherosclerosis is a disease of the blood vessels that starts with fat deposits in the innermost cell layer, leading to lipid-filled foam cells, progressing to plaque formations that can block blood flow. Inflammatory immune pathways can contribute to the development of atherosclerosis through factors such as cytokines, shown here attacking the vessel. Luckily, vitamin D suppresses these inflammatory pathways, reducing plaque buildup as a result. As mentioned earlier, vitamin D regulates the RAA system. The RAA system can cause endothelial cell dysfunction, which is the first step in plaque formation. Additionally, vitamin D directly reduces atherosclerosis by facilitating transport of high-density lipoproteins, which move fat away from vessels and towards the liver. Finally, vitamin D may also lend protection against type 1 and 2 diabetes. The literature suggests that this may be due to the presence of vitamin D receptors on pancreatic and immune tissue, but more research is needed to get a clear picture of its effects. Here's a quick recap of what we've learned. Low intake of vitamin D can have negative effects on your cardiovascular health through development of hypertension, left ventricular hypertrophy, atherosclerosis, and comorbidities related to metabolic diseases. So remember, get out there and enjoy the sunshine to keep your heart healthy. Thanks for watching.